Waking up multiple times every night to urinate. If this is happening to you, you are not alone. Over 50 million Americans, they deal with this issue and it's affecting your sleep, your health, and your quality of life. So if you're struggling with this, stick around because we're going to talk about the reasons why this happens and what you can do about it. Hi guys, welcome to my channel. I'm Dr. Peter Aziz. I'm a urogynecologist and I specialize in treating conditions like the one that we're going to be discussing today, Nocturia, or waking up in the middle of the night to urinate. So let's get right into it. Getting up once during the night is generally considered normal. However, if you're waking up two or more, then we need to talk about it. This isn't just an inconvenience. Nocturia, or peeing at night, disrupts your sleep cycle, increases your risk of fall, and can be a sign of underlying medical conditions that need attention. So today I'm going to break down what causes nighttime urination and when you should be concerned. So let's start with the basics. Nocturia means waking up from sleep one or more times to urinate. The key phrase here is waking from sleep. We're not talking about urinating before you go to bed or first thing in the morning when you wake up naturally. Here's what's important to understand. Again, waking up once is generally normal, especially as we age. However, two or more times, this is considered nocturia. And that's when we start looking for causes and solutions. This is incredibly common. About 1 in 3 adults over 30 actually experiences this condition. And that number increases with age. By the time you reach 7 years old, about 2/3 of the people are dealing with this issue. So, why does it matter? You might be thinking, oh, I'm just getting up to pee. But that's the big deal. Nocturia has real consequences. First, it fragments your sleep. You're not getting the deep sleep that your body needs to recover. That would lead to daytime fatigue. You have difficulty concentrating. Your productivity goes down. Second, getting up in the dark increases your risk of falls. This is especially concerning for older adults, where falls can lead to serious injuries like hip fractures. Third thing, chronic sleep disruption can affect your overall health. There are some studies that shows that poor sleep increases your risk of heart disease, diabetes, depression, and even reduced life expectancy. So what causes this condition? Why does this happen? There are 3 main categories. Number 1, overproduction of urine at night. Number 2, reduced bladder capacity. And number 3, sleep disorder. Let's dive into each one. So number 1, overproduction of urine. This is called nocturnal polyuria. That's the fancy medical name. That means your body is making too much urine during the nighttime hours. So normally your body produces less urine at night because we have a hormone in our body. It's called the ADH. That hormone, it tells your kidneys to concentrate the urine to produce less of it while you're asleep. But as we age, our bodies produce less of that hormone and we ended up making more urine at night. Also, several medical conditions can cause polyuria or increased urine at night, like diabetes, both type 1 and type 2. Heart failure can cause fluid to accumulate in your legs. And when you lay down at night, that fluid redistributes in your body and your kidney can process that, creating more urine. Sleep apnea also plays an important. That intermittent oxygen deprivation triggers hormonal changes that can increase urine production. Lifestyle factors matter too. Drinking too much fluid in the evening, especially caffeine, alcohol, or soda drinks, that will increase nighttime urination because caffeine is a diuretic. Alcohol can also suppress the ADH hormone production. Some medications can also cause this problem, like diuretics or water pills. If you take those later during the day for patients who have high blood pressure. The second category that we want to talk about is a small bladder, pretty much. That your bladder simply can't hold as much urine as it should. Also, overactive bladder is something very common that we see in this condition. That basically causes a strong urge suddenly that you want to urinate, and this urge is difficult to control. That means that the bladder muscle is contracting on its own. Bladder obstruction can also cause the same condition. In women, this might be from prolapse, where the bladder, the uterus, they drop into the vagina. They can kink the urethra, so you don't empty your bladder really well. In men, that can be happening also because of prostate enlargement. Urinary tract infections can also cause bladder irritation, frequent urination, Another condition called painful bladder syndrome or interstitial cystitis can create chronic inflammation that reduces the capacity of your bladder and causes urgency and frequency. We talked about sleep disorders. Primary sleep disorders, sometimes the problem, it's not that you need to urinate, it's that you're waking up for another reason, then you decide to use the bathroom while you're up. So that's not really considered nocturia because your bladder is not the main reason that woke you up. Sleep apnea is a major contributor to that. That's sleep interruptions when you wake up. Then you feel the urge to urinate. Treating the sleep apnea usually improves the condition. Insomnia, restless leg syndrome can also create a similar pattern. You're waking up for reasons unrelated to your bladder. But the act of waking makes you aware of any bladder sensation, so you go to the bathroom. So when should you see a doctor? Honestly, if you wake up once, it's probably okay. If you're waking up 2 or more times per night consistently, not just for a couple of days, that's your signal. Don't wait for it to get worse and you're waking up 5, 6 times and you can't get any sleep. Also, if you're experiencing other symptoms like pain with urination, blood in the urine, difficulty starting urination, weak stream, see a doctor sooner than later. And especially if the waking up or the nocturia is affecting your quality of life, leading to falls or causing fatigue, then it's time to get help. When you see a specialist, here's what specialists do. First, detailed medical history. We ask about fluid intake, medications, medical conditions, sleep habits. Physical examination is also important for females to check for prolapse, also to check for neurological conditions, signs of heart failure, in men to check for prostate enlargement. Basic testing like urine analysis, urine culture, some blood tests to check kidney functions, blood sugar, possibly bladder function test as well to measure how well your bladder stores and empties the urine. It will be very, very beneficial to do something called a bladder diary. It's a very valuable tool that almost all urologists use. Basically, you record everything you drink and everything to urinate, including the volume, and then gives us data about your urinary patterns and your bladder functions. So let's talk about some initial management approaches that you can do. Here are the main strategies supported by clinical evidence. So first thing is behavior modifications. These are things that you can do by yourself. They're low risk. Often they are very effective. Fluid management is important, like limiting your total fluid intake. How much? About 6 to 8 glasses per day. Drink most of your water throughout the day, however, restrict your fluids 2 to 3 hours before bedtime. Second thing, eliminate things that can irritate the bladder, like caffeine, alcohol, spicy food, especially in the evening, because these things are diuretic. Treating underlying conditions is also very important. Something like sleep apnea, you need to make sure you use your CPAP therapy because this can significantly reduce the nighttime urination. It can improve your sleep quality, improve your hormones overall. If you have heart failure, you have to see your cardiologist. You have to optimize your medications and your fluid management. And for diabetes, also better blood sugar control reduces excess urination. So just make sure you don't restrict yourself too much in terms of fluids. Don't dehydrate yourself. Make sure you're hydrated. I have a lot of patients that they're okay going to the bathroom during the day, but they don't want to go at night. So they didn't drink normally while they're awake, but then again, 3 hours before you go to sleep, they start cutting back a little bit. So here's some practical tips. You can start today. Again, fluid restriction at night. Keep a bladder diary for at least 3 days. Write down everything you drink, when you drink it, and every time you urinate with approximate volumes. This will help you and help your doctor when you go for your visit to identify the pattern. Create a safe nighttime bathroom path. Use night lights. Remove any tripping hazards. And consider a bedside urinal or commode if mobility is an issue. Practice good sleep hygiene. Keep your bedroom cool, around 68 degrees, dark, quiet, consistent sleep schedule, and be patient with treatment because behavioral changes can take time. Give them at least 2 to 4 weeks before deciding if they're not effective. Remember, this is a very common problem, but it's not something you have to live with. Waking up multiple times affects your sleep, your health, and your quality of life. The good news is there are some effective evidence-based treatment. Whatever the cause is, make sure you see your doctor. You can start with some simple strategies to manage it. However, when it gets worse, there are other treatments that are available for you. If you found this video helpful, please like and subscribe. I create evidence-based content about female urology, pelvic health, and wellness. I'm going to be creating videos about other treatments for overactive bladder, for nighttime urination. If you have any questions or topics you'd like me to cover, please write them down in the comments. I'm Dr. Peter Aziz. I'll see you in the next video.